$1.245, something like that, $1 million. We anticipate spending the rest of that for this year. Going forward, the maintenance costs, we're anticipating to be right around $899,000. And of that, $633 is storage costs, and that's directly to TASER. So that's a contractual agreement that we have already made with TASER for the first year. And actually that goes out for the life of the contract, basically. We already have the 2 forensic photo techs in the budget from last year. So those people have been hired and they are already working on, on this project. And so we anticipate that, they'll continue on as well. We do have some additional phone costs, as you know, that when we implemented the body camera project, the phones, we added phones with them so that they could annotate in the field instead of coming back and having excess payroll costs at the end of a shift. So there are some additional phone costs. We've received some credits for these so far. So this number is a little bit soft at this point going into, it's fine for 2017, but going into 2018, we'll reevaluate. Things are changing all the time with phones, and we'll reevaluate, obviously, at that point in time. So that's kind of an overview if you have any questions.
So in continuing that, so 2016 budget, that's been able to be absorbing all the anticipated costs, and this is a 2017 request based on that information. Is that right?
That's correct.
Good. Okay. Councilmember Glidden.
Thanks, Mr. Chair. So my question's a little bit more about, we've had some various conversations about what may be the costs that relate to responding to data requests. And so I'm not sure if there's another place in your budget where you talk about that. I mean, I guess what I kind of have taken from all of this is that, there's a need for us to continually analyze what are those personnel costs really going to amount to, and how are we putting in good controls to be able to assess what is what's the number of requests, how long is it taking to properly analyze them to produce the public information and those kinds of things. And I know there's some crossover as well with other departments, including the clerk's office. And so I wonder if you can give us a little picture of kind of how, I guess it's both a program analysis and a budget analysis of how is the police department taking on that task and continuing to evaluate those needs.
Okay. Mr. Chair, Councilmember Glidden, regarding specifically the body cameras, right now we have the 2 photo techs who are in that group. Right. Since we just got the body cameras initiated completely yesterday, we don't have a historical record, so to speak. At this point in time, we feel that the 2 we have are sufficient. Whether that changes, if there's any legislative changes down the road or any other changes as far as releasing information, that certainly would impact the numbers. But based on the information that we have right now, we feel that 2 is sufficient for body cameras.
2 is sufficient for 2017, is what you're saying. And then kind of my other question, though, was what protocols are you putting in place to continue to assess the ability of those techs to respond? Again, as you just said, we're just on the cusp of implementing this very large and new program. So there's a lot of unknowns, and I think you're right. We don't want to get ahead of the unknowns with too much resource, knowing we have resource needs in other areas in the police department and throughout the enterprise. But just it is going to be an important topic, I think, to continually assess.
Yeah, Councilmember Glidden, you're absolutely right. DC Glampy, who's involved in the data requests area, bureau chief over that area, is constantly evaluating the number of requests that we get and keeping track compared to prior years. There's 2, I guess, points here. One is the body cameras, which we feel that right now we're adequate, and it's hard to anticipate what we might need. The other is just data requests in general. And I think that throughout the city, I don't think the police department is different than anybody else, but we're getting continually more and more data requests. And what we'd like to see, and what we've been in discussion with, is looking at a citywide solution, not just an MPD solution. And there are some things that we think there could be some economies of scale if we're all working together instead of just the police department responding to those data requests. So that's something that really needs to be a project and an incentive from the city, from a citywide perspective.
So just to that question, because we did have this budget discussion, I can't remember exactly when it was, about the enterprise, that there was an enterprise need. It wasn't just police department issues, although because of the body cameras were focused on this new area. Is there an enterprise team that has been formed to assess these needs for the city, or is that something where we need to, because it's already been brought up, I think, is it something where we need some direction for that to happen? Because I think we kind of indicated we were hoping that would happen many months ago.
Right. Mr. Chair, Councilmember Glidden, I do not believe there is an official team. I know there's been quite a bit of discussion about it between various
That's disappointing
departments.
then.
But I do think that there needs to be direction.
Propose that right now.
Okay, well, that's helpful for us to know, and it does seem like it's very timely, should be happening so that there's a structured conversation within the enterprise and some facilitation to what are the elements we need to be thinking about. So, and I know Councilmember Palmisano is her little thing up, and she's been very involved in these enterprise type questions and conversations.
I think that's a great transition to Councilmember Palmisano. If you just talk about it, I think a lot of this came up through the audit process as we're talking about records management.
Mr. Chair, I just wanted to mention that this was part of an enterprise-wide data governance audit, the results of which we're still working through. And so most heavily involved is actually the city clerk's office and Christian Rummelhoff, who has been leading efforts, who has been in heavy conversation with Deputy Chief Glampy, amongst others. And I believe there's a small amount of project money in the city clerk's budget proposal to address some of this. And the rest of it would need to come from more of a collaboration between the police and Christian Rummelhoff's purview. I too wish that it could go a little bit faster, and I'm eager to get that done. So I'd be happy to move forward a more formal work group if we think that would be productive at this time.
Yeah.
Go ahead.
So I think maybe this is an opportunity for some conversation with the coordinator's office, because I just I think this is an enterprise-wide issue, and we need to identify who can facilitate the conversation, knowing it's an enterprise-wide issue. And I would really see that is the typical role of the coordinator's office, to help make sure when there's enterprise-wide issues that all voices are at the table and that they are facilitating, knowing that other departments may have specific roles that put them in a leadership position for certain functions. So I would suggest maybe we want to talk with the coordinator's office on how to manage that process. And they, I think, could also do the work to reach out and identify what's the right timeline to make sure, we're not meeting for the sake of meeting, but we are able to put together a structured, thoughtful process on what's a big issue that cities all over are facing in terms of these data requests and effective and transparent and proper responses. So,
great. Thank you very much. One final question on this portion. This is a ongoing request, not a one-time, right?
Correct.
On the 325, because the previous 5.74 have already been absorbed in the previous budget as part of the levy.
Yes.
Thank you very much. All right. Thank you.
And yes, this was later in the presentation, but I'm glad to have the conversation. And I do appreciate being brought up on an enterprise-wide level, because I certainly don't think any of us want to get in a place where we're behind and now we're trying to figure out it's coming and it's going to increase. And so the sooner we can collectively come up with a best process, the better. And I really appreciate that. So this next slide is meant to show that most of our costs are payroll related, plus costs that are more fixed, such as rent, utilities, jail charges, federal contractual requirements. There's little or no flexibility outside of the with the beyond, the 77% payroll costs, and then those other ones are fixed costs where we have no control over the increases on those.
Excuse me, Chief.
Yep.
I have a question from Council President Johnson.
Thank you, Mr. Chair. And Chief, when I was looking through this, I saw the contractual increases, which I thought perhaps was contractual with the new police contract. How have you accommodated in this budget for?
Nothing in this budget has any implication on a contract. We do not have a ratified contract. We haven't gone through the city council process. So nothing in here is reflective of
What could be a potential?
contract,
Okay,
correct.
okay, great. Thank
Yep.
you. That answers my question.
And in case there's other questions, that includes the Super Bowl.
Okay.
Okay.
On the jail charges that you were talking about, I think
Yes.
as a result, was it last year that we renegotiated those contracts? How did this compare in the 2016-17 timeframe with what we were doing in 15-16?
Mr. Chair, sorry, I'm thinking about what those numbers would be. Back in 2015-16, we were paying for some items that we renegotiated. And so the number in 2014-15, we're more along the neighborhood of $2.2 million a year and growing. Right now in 2016, what we anticipate for the end of the year charges will be $1.8 million, so a significant cut on a per year basis. I do not know yet and have not received word whether the daily per diem rate that the county charges is going to change for next year or not. That could have implications for 2017, but at this point, we're still anticipating $1.8 million for the jail.
Thank you.
Any other questions on that?
Just have one more. Yes.
Excuse me, Council Vice President.
Thanks. It's just this is a little separated from my chart that was the ongoing and the one time, and Councilmember Bender actually just flagged this. This is really her question. But so this is added to essentially the base. This is ongoing costs that will then, as far as we can anticipate, cover the ongoing costs of body cameras until we have new information. Is that what that is?
Correct.
Okay.
So next is the crisis intervention pilot program. The mayor had mentioned in her budget a one-time change to allow us to have a pilot program. We are currently we have a working group, and so we're in communication with Hennepin County. Probably somebody who we will eventually contract with, looking at best practices. We anticipate starting in January, February. I'm not sure if you had any questions on the program or the project. It really seems like something.
Yeah, it seems like
going to be.
you could say a little bit more
Well,
here, I think.
Well,
There's a couple of questions on it.
the what I can say is that we know that there has been this co-responder program that has been very successful in other parts of the country, and allowing officers to respond and address mental health issues with those that are much more trained and educated in that process. What our teams look like will probably mirror that very closely, but we want to have our own working group, which we have in place to really look at what might be best for the city of Minneapolis. Not always can you just overlay something into your own city. You have to make some adjustments and changes. And we learn from their lessons along the way.
Council President Johnson had a question.
Thank you, Mr. Chair. I would wonder, actually having many years ago worked at the crisis center at Hennepin County, will we be working with their current model? I know they have programs in place for behavioral outreach and what's the word I want to say? Crisis intervention for people that are in their system. So I want to make sure that we're not duplicating or interfering, I guess, with what they have as an existing program.
Yeah, that's fine.
Mr. Chair, Council President Johnson. Right now, we are just in the working group phase. And we have talked with them and they are interested. But what we anticipate, and again, this is anticipate, what we anticipate is that these responders from Hennepin County or from another agency would actually go with our officers to the scene of an issue and work side by side with those people, with our officers, with dealing with people who may be having a crisis situation at that moment in time. So that's the program that we're initially looking at. I'm sure that they will come with some additional changes and recommendations, both before they start a pilot program and after. So we'd be happy, once they determine what that pilot program is, we'd be happy to give that information in front of public safety, for instance.
I guess that goes to my question, that they have, I know that they have existing programs.
Mm-hmm.
And so, I mean, are we anticipating that we would be a part of their program, or are we going to have our own program and pull them into our program? I'm really, I need to be convinced about this, I guess is what I'm going to say.
Council President Johnson, I would have to get more information on where they are right now. I've not attended the meeting, so I don't know what they're looking for, but I can certainly get that information for you.
I think it would be helpful to have that in front of public safety before we jump on a program.
Sure,
Really would.
not a problem. I will do that.
Council Vice President.
Thanks, Mr. Chair. Kind of along these lines of just trying to understand what this is, and I guess that's helpful to hear from Council President of kind of her knowledge of some different things going on. I know that the PCOC did a report, and I haven't read the whole report, but which I think was more looking at other models, maybe that kind of review of other models that are happening in other cities. I guess I just need a little bit better information on what would we use this proposed funding of $200,000 in one-time dollars for? Is that, just to make sure I'm clear on that, are you proposing that is for a design process to essentially do whatever you would do from the police department perspective, to hire a consultant, I guess, and bring in stakeholders and conduct a best practices review and then come up with a proposed model? Is that what I'm hearing you say? Or maybe you are saying something different. And I just want to make sure I'm understanding what's the funding for, as you anticipate you would use it to evaluate this as an option for the city of Minneapolis.
Okay. Mr. Chair.
Because pilot usually says to me something different. It says experience. And when I hear pilot, and it looks, from what you said, it seemed more like you were in a design phase of wanting to see what's right.
Yeah, Mr. Chair, Vice President Glidden, we are in a design phase, but a pilot allows us to make those adjustments based on a kind of what programs we've seen. And as far my understanding is, this funding would be actually to have those professionals come work with us. We're not going to go supplement what they're doing. This is for a better response for police officers, and so that they have those experts along with them. So we don't know what that cost is. I think the number, you might need to help me on where that figure came from exactly.
Council Vice President, the idea, none of that $200,000 is going to be spent internally. The idea was for that money to all be spent externally in hiring people to co-respond with the officers. So the design process is something that's happening right now. Once the design process is finished, which we anticipate would be fairly quickly, actually, and it is, by the way, based on that report. Okay. That was one of the items.
That's helpful to know. Okay.
Yeah, one of the items in that report was actually to suggest a pilot co-responder program, and we concur. But the $200,000 is really to be used for hiring people from some of these other agencies who would co-respond with the officers. So it is not internal; it will not be internally spent.
Okay. And okay.
Helpful. Thank you. Also, I had Councilmember Bender. You had your.
Thank you, Mr. Chair. I think most of my questions have been answered. I will say I appreciate this being proposed. I think it is in response to a lot of the feedback that has been heard through the various ways that the police department and others are reaching out to community to continually improve on the service we're providing. And I know that this has been highlighted as a big area of improvement, just being able to provide a different kind of response when it's required in the situations where people are experiencing emotional or mental illness. So I appreciate it. I appreciate hearing more about the detail and background. I think perhaps maybe it makes sense to brief council members as people may need more fully on this. But I guess since the questions have mostly been answered, wanted to note that I appreciate this coming forward in response to a lot of the feedback that has come forward about this.
Thank you. And Mr. Chair and all members, I'll make sure that we put together more information as we get that, which is relatively, new for us as well as far as what we're doing moving forward and how this will look. But I'm pretty confident that once we're done, we're going to have a very effective program for the city.
Thank you.
Next is the complaint intake process, change amount of $10,000. This is in response to, as you're aware, that the PCOC went out and went to precincts and tried to make complaints, and we learned that we had some inconsistencies in how people responded, what information was given, and so this is actually an opportunity for us. We've already made some additional changes. We have cards online that really lays out the consistency on where people can go to make complaints, how that process works. We've been training our supervisors and our sergeants, and now we're moving into some of the investigative sergeants as well to make sure that they have the training and so they can provide that for the officers.
Council Vice President.
Thanks, Mr. Chair. I can't resist this opportunity to bring up something I know I've brought up before, but to me, this relates a little bit to what the kind of a personnel issue or organizational development issue with the kind of these folks who end up at the front desk in a police station. And it's just because just be honest, there's some variety there. So you have some police officers who really enjoy that role, and you come in and they give you a big hello, and and they enjoy that feature of being there. And then some don't, and and I don't know what are all the variety of tasks that you're able to do in that spot too. Maybe there's an issue to making being in that spot feel plugged into responsibilities that are important to the precinct as a whole and things like that. So I'm not sure how that workflow works at the front desk. I just don't know. Mm-hmm. But this seems also kind of tied to an opportunity to present more of a priority to how important that front desk position can be. It is such an entry point for folks who just don't have these other, the secret ways of knowing there's a crime prevention specialist and other things, which is once you get to know the crime prevention specialist, that's great. But for a lot of people, there's the police precinct. I'm going to try to go there. I still run into folks of kind of all backgrounds who say, well, I know where the precinct is there, so that's where I'm going to bring my question. And so I couldn't resist the opportunity to talk about that and just ask your thoughts on that, because I do think that relates to this report that they did that was more about what's the consistency with understanding how to do a complaint if someone needs to have that assistance.
Mr. Chair, Vice President McGooden, I couldn't agree with you more. And, it was after their study came out, it was actually reinforced things that I already knew, but we tend to have to address those very street level pressing issues. And you realize when you're trying to build public trust that those folks are the very front line oftentimes as people come into the precinct. And there's a variety of reasons now why people are on the desk. Before I got here 30 years ago, we had desk sergeants. And I thought that was really kind of silly. Why would you put a supervisor sergeant on the desk? And now I have a pretty good idea why that might be beneficial, because it really it's a different role. It's a job in and of itself, and you have to be customer minded and be patient and frankly have all the answers. And there's some really phenomenal officers that work the desk, but it's not generally a permanent assignment. But for those who are, because they are injured permanently, they do a phenomenal job. They take ownership of that desk. And then other times it's just somebody's there temporarily, and that's not the case. So two things we're doing. One, we're trying to at least make sure we're arming and training people and making it consistent. When somebody comes in and asks A, B, C, or D, the responses are similar in each precinct. So that's on us to make sure they have that. The other is to really look and analyze, do we make this more of a position that we give people either a benefit or something to be on, that it's something that, hey, I would like to have this position. So I wasn't happy with the results, but I do see it as an opportunity and something that now we know that we have to focus on and prioritize. And, you know, it was on my radar, but something I didn't get to when I would have liked to.
Council President Johnson.
Thank you, Mr. Chair. I really want to concur with Council Vice President Glidden. It is a customer service issue, and I have had inconsistent, experiences over the years, and it's just a big deal when somebody has a face-to-face with a city employee of any, our public works people, our police officers. It's a first impression. It makes a huge impression. So I appreciate your bringing that up, Council Vice President, and I think it is really important that we address this.
Thank you.
Yeah, I remember as several of us are on the Public Safety Committee, so we'd seen that report. I really appreciate PCOC taking that up as a topic, and this is able to be responding. Part of what came out of that report, though, it wasn't just about the personal interaction. There was also the online face and inconsistency within the web interface and making it easier for people to get into it. Is that addressed at all in this change request? The online component.
Yes, there is, Mr. Chair and Council, there is the ability to do complaint forms online, get the information online, and then we're also have all of our dashboard and our information on there. But Commander Case, who's in charge of internal affairs, who works closely with OPCR, is there in conjunction with what that can look like on the website.
Thank you.
The next 4 slides show some of the public safety services. I do want to highlight, because I think that our officers have done an incredible job over the years in the area of burglary. That's something that I know when I first became chief and before I was chief was really on the minds of residents in the city, were the number of burglars we had. And I do think that the officers being more of investigative first responders versus just taking a police report and knocking on doors and talking to potential witnesses have really helped us in making arrests and really pushing down burglaries. And so we've continued to have success with that. At the same time, we look at response times, and that's our balance always, is making sure that people aren't waiting too long for those priority 1 calls and that we get there in a good amount of time. We are down slightly, which I'm glad to see, from 9 minutes and 26 seconds to 9 minutes and 4 seconds on our priority 1 calls. The other ones, we're maintaining our response times for the most part. We continue to strike a balance with the direction I've given officers, and that is to spend time on calls and not just be throwing blue cards at people, frankly. That may be their only interaction with the police. So we need to make sure that we have adequate resources, that people are able to respond, and when they get to a call, they're not just there fast, that they actually can do something when they get there. And that, too, has impact on public trust and support and confidence in their police department. If the only time they call, they get a 2-minute, can't do anything, I got to go to the next call. This is about making sure that we're very effective when we get there. And Crime Lab has been phenomenal in, I should have mentioned that in the burglaries as well. Any questions on response times? I mean, we continue to look at those and try to reallocate the best we can given response times.
We do have a question.
Okay.
Councilmember Palmisano.
Mr. Chair, Chief Harteau, I'm curious, because response times often are a product of staffing, and I know that we backfill with overtime costs when we have been low in the past on staffing. But can you remind me and my colleagues how many police officers we fully have on board today? Because I know that number has gone up significantly this past year.
Mr. Chair, Councilmember Palmisano, we currently have 820 enroll. We have 20 we have people in training. So we have 26 cadets that will be coming out on November 1st and another 32 December 20th. So I believe that's close to 870 something, which is close to where we want to be. That's given no attrition, any additional attrition, which I do anticipate. So we are definitely going to feel a change when those 50-some folks hit the streets by the end of the year.
Thank you. And you said the first number was 824?
820?
820. Yeah.
Yeah,
that makes
and I say enroll because we're paying for, I don't know if you have that total really quick, about 877 people right now, but with 56 of them in training,
Thank you.
they're not on the street answering calls or investigating cases. Where am I? Okay. With administration and training, the increases are due primarily to change requests for the additional sworn, additional CSO class. So the change of the 2.3 million includes the 15 FTEs that the mayor had put in the budget and discussed. Having 12 of those FTEs do community policing, and the 3 as part that would be directed at the co-responder project that we talked about earlier.
Okay. Council Vice President Glidden.
Why don't you finish your slide?
And then, obviously there's a multitude of reasons why we need to increase in staff. I mean, you can see with our overtime, how that's increased to backfill and staffing. Violent crime increases, certainly balancing our law enforcement with community engagement. What is the proper number to have a good percentage of that? Public expectations of security with visibility, livability, our ability to be able to investigate cases. The city is growing. I talk about all the time where we have uptown, downtown, and Dinkytown. That makes a difference when you have those businesses thrive and there's more people in areas. And of course, all of our stadiums and what that changes things.
Okay.
Now we're ready.
All right. Thanks. If you could go back to that. Thank you. So 15 positions. When you say 12 are for community policing, tell me a little bit more about where you see 12 of those positions being placed.
Mr. Chair, Vice President Glidden, that at the direction of the mayors, the community policing would be just in the precincts,
Okay.
not
Well,
in other parts of the city, but we would put them in the precincts, and their function would be the assignments or those that had the engagement with community, but also the ability to handle 911 calls. But they would be based on where we see the needs as we look.
So I understand the mayor's direction, but I wanted to ask you a little bit. Is that where you see if 12 officers are approved within this budget, is that where you see the best need for 12 officers? Is 12 additional officers assigned to the precinct?
Mr. Chair,
And then I'll have a follow-up question on that.
That's great.
Okay.
I see as we analyze, we look at where our response times are low, where we're having crime, and I see putting them in the precincts or precincts that have the greatest need to be out in the community doing policing.
Okay. So then I'm just curious why there's no discussion about adding to investigations. So, I mean, part of what we're seeing here seems to be, an increasing number of cases, an increasing amount of need for investigations, because I got to say it's, the officers in the precincts do one piece of police work, but there are many other pieces of police work that are vital to our ability to be able to stop violent crime, which is solving those crimes. And so I get always concerned, and that's why I asked. I really want to know, why are we saying that 12 officers in the precinct if you have this number, and then I guess the other question is why 12? What difference is that going to make? Why is that the priority for where to put these officers?
Mr. Chair,
Or
Vice
these
President
new
Glidden.
positions, I should say.
Right.
So,
Mr. Chair, Vice President Glidden, this is moving towards a sworn staff of 901.
okay,
So-
but right now,
Right, right.
we're
But
talking
I'm
about
just-
12.
right.
So I got to say,
setting that stage, though, with increasing staffing, we need to look at where we have the greatest need. And where we have the greatest need is responding to violent crime and priority 1 calls. And so, yes, as we move forward, we can be moving people into investigations as we grow in the department. We are constantly evaluating different investigative entities and what needs most, and maybe we can make changes. And we've actually removed certain specialty units that no longer serve the valuable function that we have. But this is where we have the greatest need. I would like more as we move in the future to be able to accomplish all of those things.
Okay. I feel I'm a little surprised that there is, with 12, none of that would go into investigations.
Mr.
So-
Chair, Vice President Glenn, although what you don't see on here is those officers that would be on the street help us to be able to promote and put people in investigative assignments as well. So there is that transition as we see. So
But
that we at
that's
least,
saying that the 12 is not additional to the precinct.
Well,
That's
we have to
saying something different, which is more what I was wondering, which is you put new officers on the street, and then others from the precinct are able to move into this role that's for more experienced folks, which is investigations.
it does help alleviate that. So when you have the officers on the street, because we have to continue to maintain a certain level of sergeants based on our authorized strength, and we have to have them in those positions. So the increase helps us across the board. It truly does. But the greatest need right now is with them on the street.
Then my other question is, you have 3 officers assigned to the co-responder project, but we haven't, and I think that this is a very worthwhile thing to explore. I mean, you listen just generally to what are the statistics on the numbers of calls that officers respond to that have some element of mental health being part of that response call, and it's certainly says we need a better way to respond and support the officers in being able to provide the right service in that call. But why are we? Why 3 FTEs now when we're just finishing the design and we haven't even started a pilot? How do we know 3 officers is what we need to even try co-responders? So I just want to make sure I'm understanding kind of why 3, how do we know that? Will those 3, no matter what, since this is still just a pilot, be assigned to this work? I just am not quite understanding.
Mr. Chair, Vice President Glidden, first I need to say public safety is number 1 priority. Saving a life is number 1. And so, 1, that's why we need people on the street to answer those calls and respond to violent crimes. And 2, us being able, and correct me if I'm on the 3, is that's a number that we're looking at based on other people's programs and what might work. And so if we need to adjust that, we will. If we don't need them, they're going to be working a regular job until this is up and running. So it's not as though they're not going to be doing anything while we're working on the pilot. These are officers who will be on the street handling 911 calls.
So maybe we should think about this more as just 15 officers, and as you develop a program around co-responder, some of these, maybe up to 3, will have some of their duties more designed to work on the co-responder model. Is that maybe more accurate? Or
Mr. Chair, Vice President Glidden, I should have said that because it's very accurate.
okay,
It's 15 additional officers.
okay. I just want to make sure I'm understanding what are we faced with in terms
Right.
of decisions here.
As in
Okay.
any of our numbers, we have to constantly be looking and reallocating and move them given whatever's happening in the city and frankly in the nation at the time.
Okay. And then my last question is, where are we in terms of our hiring process in relationship to our authorized staffing levels right now for officer positions? So we're
Next slide.
authorized to what's our number right now, and then how many are actually, what's our,
You teed me up. So it was originally 862.
okay.
And if you look, I just mentioned we had the 820. We were projecting to have 868 FTEs by the end of 2016. But with those that are in training right now, we would, that's